Me and my friend will explain about total parental nutrition. The short form is TPN. So now we will begin with the first part.
Hi guys, thank you so much for you guys watching this video. So before we started, let me introduce myself. Hi, my name is Junici. Nice to meet you, and my program is Diploma in Pharmacy. So now I'm gonna talk about my part, which is I'm gonna talk about aims of TPNs. So before that, what is TPN? TPN is a total parenteral nutrition. It is a method of feeding that by process of gastrointestinal tract. So fluids are given into a vein to provide most of the nutrients the body needs. So this method is used when a person cannot or should not receive feedings or fluids by mouth. As you guys can see at the slide, any slides, I don't know where side. So as you guys can see, the aims of TPNs is to provide nutrition requirements for optimal growth and maturation of the infant. And then the second is it is a substitute for enteral feeding in the circumstances where the establishment of full enteral feeds will be delayed or inadequate. And then however neonate remains breast milk. So here we can see is talk about a newborn baby. So yeah. So here's the aims, and I hope you guys will understand about TPN.
Hi, my name is Dina Kilabiti Mazlan. So my part is what is necessary. TPN is used to provide nutrition in situations in which establishment of full enteral nutrition is likely to be delayed. The provision of balanced nutrition, carbohydrate, protein and fat is essential to provide for growth and prevent catabolism. Early TPN with destroyed amino acids and lipids has been shown to reduce hypoglycemia, increase plasma amino acid level 32, and increase albumin levels in preterm infants. 41 studies are found that prove TPN decrease either morbidity or mortality and are now unlikely to be undertaken as it would be deemed unethical to withhold TPN from a control group.
Good morning, good afternoon, and good evening for everyone. I will introduce myself first. Yeah, my name is Aisla. It's from Diploma in Pharmacy. Okay. And I will talk about indication for TPN. Yeah, is for infants. But before that, I will talk about why use TPN and more detail of nutrition. Nutrition is the guarantee for normal growth, development, immune function, disease recovery, and damage repair. The collective has basic physiological requirements for various nutrients, such as protein, glucose, fats, waters, electrolysis, fertilizer elements, and vitamins. And there are certain difference between different age and genders. So this is very important for infants, child, is immunity. So who is trauma needs to more nutrition to maintain energy and provide energy, or unable to use the diet normally, and this must use TPN because it directly enters the meridians without going through the digestive system. And fat, protein, and glycogen provide heat energy, can give body to maintain the energy. So TPN has certain practicality and significance. Okay, so we go back to indication for TPN. Yeah, this is for infants. Yeah, first one is premature infants less than 30 weeks gestation or 1,000 gram, or more than 30 weeks gestation, oh, but unlikely to achieve full enteral fits by day 5. And the next is infants at high risk of NEC, and is less than 30 weeks gestation and more than 30 weeks with absent or reversed fetal umbilical artery flow, and or for infants with perinatal asphyxia, okay. Okay, then last is same is NEC. NEC is necrotizing enterocolitis. Necrotizing enterocolitis and gastrointestinal tract is anomalies. And guys, I hope understand what is indication for TPN. Yeah, it's for advanced this. Okay, thank you.
Hi there, my name is Georgie Monica, and what am I here for? Obviously to talk about the next topic, which is site of venous access. So basically, TPN is administered into a vein, generally through a PICC, peripherally central catheter line, either through a central vein or peripheral vein. In some situations, parenteral nutrition may be safely delivered by peripheral access. It is a short cannula or midline catheters, as when using a solution with low osmolarity with a substantial proportion of non-protein calories given as lipid. Therefore, it is recommended that peripheral parenteral nutrition should be only used for limited period of time, and only when using nutrient solution that to reduce the rate of thrombophlebitis. What is thrombophlebitis? Thrombophlebitis is a blood clot which can form in your blood as a result to an injury to a vein. The signs of thrombophlebitis includes pain, swelling, redness, and discharge. So if this sign is developed, the catheter should be removed. And next is central line. Central venous access may be delivered via femoral lines, internal jugular lines, and subclavian vein catheters in the hospital setting, while on the other hand, PICC are inserted via cephalic and basilic vein. Manipulation of the lines for TPN should be kept to a minimum, and the line should not be used for any purpose but nutrition. Okay, let's move on to the next slide. As you can see here, this is the route of administration for central and peripheral line. You see here, the first work shows central vein have high osmolarity. Because high osmolarity, parenteral nutrition requires central venous access to deliver all the nutrients. Central venous access can also be used for more than 2 weeks. Means it can be used for long-term treatment. It must be high calories to provide patient with all or most calories nutrition through solution that contain protein, carbohydrate, vitamins, and minerals. We look at the second box for peripheral line. The formulation of osmolarity must be less than 900 osmoles of solute per liter of solution. Parenteral nutrition may also be administered via peripheral access when the therapy is expected to be a short term, means it must be less than 2 weeks. Food restriction is not necessary. Lower in calorie means energy and protein needs are moderate. Okay guys, that's all for my topic. Let's move on to the next topic.
Hi, my name is Halimatul Saida binti Osman. Okay, so for this part, I can tell you about the prescription of TPN. Okay, at this slide, for the first point is premature infant tolerate TPN from day 1 of post-life. Premature like a premature baby. Okay, and the second point, this TPN can be delivered using two bags. First bag is we call standardized bag, and the second bag we call individualized bags. Okay, and the third point is there is RCT evidence that most TPN prescription can be adequately done using standardized bags. Okay, for the 3 points, RCT means randomized controlled trial. This is we call the short form. We can call RCT lah. Many pharmacies choose the standardized bag. It is because they are both easier and then cheaper. It's the most cheaper like that. And then this is the preferred method on this unit lah. Some babies, particularly if they are very unstable or not stable, they need the individualized bag. For this part, they have the computer program within the database to add with this individualized prescription to babies that